Hello, this is Dr. Do again. This video is on alphabetic list problems, still on letter M. I think I'm going to talk about the multiple sclerosis. I thought I have talked it in some other stream of the videos, but probably not. But anyway, since this multiple sclerosis is so common, however, it's very easily to be missed because sometimes it's just self-limited disease happened and then recovered, and then later on, many months ago, another symptoms and presented again and recovered without medication or without medical treatment. But until suddenly it just cannot be managed by self, or is not self-limiting when it reaches to the severity that has to be managed by the medication. So anyway, is there any associated emergency situation with this multiple sclerosis? Probably not, unless depends on which nerve is involved. If it's involved in the optic nerve, then probably it is quite urgent. So you need to see the physician, either primary or ophthalmologist or emergency right away. Usually, it's subtle symptoms and chronic. It could be acute and resolve in a couple months. Like I said, can you manage at home? It's not. I think if it is identified or diagnosed, cannot be managed at home. It has to be managed by the prescribed medications, unless, as I said, the symptoms are kind of subtle and self-limited. You did not do anything, just went away. It's possible, but it's just a very occasion in very small amount of cases. So anyway, what is this multiple sclerosis? It is quite common, particularly in young female. The symptoms characteristic of this multiple sclerosis is the multiple locations and in dashed or different time. For example, you probably sometimes the presentation is like probably currently had the knee pain and went away, and later on 6 or 1 year later you have the eye pain or here. So the characteristic to define this disease is multiple location, different location, and in different time of occurrence. So what is the mechanism? What is this multiple sclerosis? The name that makes sense in terms of multiple sclerosis. Sclerosis means become hardened or stiff. So basically, this is the autoimmune disease caused the demyelination of the nerve fibers. So that is the mechanism. And particularly, I think it's autoimmune caused after the viral infection. I'll just briefly mention about the nerve cells. The nerve cells has a center, which is the neuron, the central neuron that's containing the nucleus and also a lot of mitochondria, and through a long fiber and to the extended to the synapse, and then or receiving or sending the signal. And this, the fiber part, wrapped with the myelin, which serves as insulation, affiliated with the signal transduction. So in the normal way, just like the wire of the electricity wire, there's a wrap of the rubber outside of it. But in this multiple sclerosis, those myelins degenerated, fell off. Just like if you imagine the cord of electricity cord, some of the rubber lost or through the erosion or whatever the cause, then it just lost the conductivity, and especially for the nerve fibers, this demyelination caused the signal transmitted in between around tissue or impaired signal transduction. So that's the mechanism of this multiple sclerosis. In terms of risk factors, like I said, usually young female with the viral infection, viral infection, and sometimes with the genetic predisposing risk factor, and I was not quite sure. The clinical symptoms are really, like I said, the multiple locations and in different time. So like I said, usually I think one of the quite common presentation of this multiple sclerosis is the eye pain, eye symptoms. But it's not in older people, like the other eye pains, like in addition to eye problems, the vascular, the giant cell arthritis, for example, also present with eye pain or headache. But usually occur in the older people, but this is young people could have the eye pain is one of the quite common presentations, or feel numbness, tingling in one arm, one finger, or one leg. It's just here, and this time is here, next time is there. There's a space of time in between of different symptoms, different presentations. So this is the characteristic of the multiple sclerosis. And in terms of diagnosis, I think pretty much clinical, and unless if their suspicions can do the neuroconducting study, but usually it's clinical diagnosis and treated with steroid to accelerate the recovery and also to prevent the recurrence and maintain the good remission period. So this is about multiple sclerosis. In general, it is really subtle. It's not quite like other symptoms, like other neurological diseases. You have this, but the subtle symptoms really bothering, interfere with daily life. So the take-home message for this is the young female. If you have this kind of subtle symptoms that bothers you, and either tingling or eye pain or lost muscle strength in just one limb or one area without any other risk factors like hypertension, diabetes. So this probably is the cause of this multiple sclerosis. The symptoms may be caused by this multiple sclerosis, and try to talk to your physician and monitor for a couple of days. If it didn't go away, really need to talk to your physician. Sometimes the headache itself can also indicate probably it's because of this multiple sclerosis. Like I said, the presentations is a variety, and the locations are different, and there's a different in between of one episode to another episode. There is a couple months or a couple weeks, a couple months or year. So this is about multiple sclerosis. Probably you already know it because it's quite common and easily to be missed. That's why I put the video here. I hope if those young female, if you had this kind of episode, not just once and multiple times, then probably it's a good idea to get it checked out, to make sure it is diagnosed as multiple sclerosis or it is not, to exclude, then you feel better. So I'm going to stop here, and hope it helps, and thank you for watching. I will see you next time.